Ladies and gentlemen, with that, we will now go on to the next session. We basically now have a brief presentation on India Africa Health Summit. Now, ladies and gentlemen, as you can see that IP Global Group is the largest social sector consultancy firm in South Asia, and Mr. Ashwajit Singh has over 30 years of experience in development consultancy and advisory services. And I'd like to also inform all of you that IP Global offers a range of innovative and sustainable solutions to help their clients address their health, education, environment, gender, infrastructure, and international development challenges. Mr. Ashwajit Singh, a warm welcome to you on day two as well of the NATHEALTH 7th Annual Summit. I'd request you to please take over.
Thank you, Aishwarya, and um, good afternoon, all of you, all the delegates. Especially, I'd like to thank Dr. Peeta Reddy, Dr. Harsh Mahajan, President-elect, and Siddharth Bhattacharya, and all of you for inviting me to present the Indo-Africa Summit that NatHealth had organized. In the last session, we, of course, and in the earlier sessions, we've been hearing about the need for enhancing or improving the relationship or the working relationship between the government and the private sector, which of course is very important if we are looking at improving the healthcare situation in India. But I think equally important, at least if we are looking at achieving the sustainable development goals of universal health coverage and care, it is important for India and Africa to also collaborate, because if we talk about the SDGs, if we talk about really trying to improve the lives, including the health coverage across the world, the two regions that need maximum help, at the same time perhaps maximum cooperation, are India and the Africa region. Now, keeping that in mind, NatHealth has pioneered a discussion with a similar organization in Africa, the Africa Healthcare Federation, and together they were able to organize a summit in December where they spoke about fostering relationships in South-South healthcare, universal health coverage, and relationships where they could work together to try and improve the health coverage. If you can just please start the slide presentation. So this is something that took place on December 12th. It was a half-day summit organized by NatHealth along with the Africa Healthcare Federation. IP Global and Pricewaterhouse were the knowledge partners for this. So I'm just going to be presenting, a report on what happened and, of course, the next steps. We can move on, please. As I've already mentioned that India and Africa, they're the most dynamic as far as economic growth is concerned, strong historical and cultural connect, and of course, most important, common healthcare challenges. We have the same levels of poverty, we have the same levels of poor infrastructure, same levels of health challenges, same level of not very good indicators around health, especially when it's compared to the global indicators. It's important for both South-South to really collaborate if we are looking at working beyond just in our own countries. Could you move on, please? If you look at some of the indicators, it's very clear that the burden of non-communicable diseases is expected to surpass the communicable burden. If you look at WHO reports, you'd find that 16 of the African countries and India together really account for 90% of the annual global TB burden. Both regions are rapidly urbanizing. Along with that comes a huge pressure on healthcare. Given the GDPs and the levels of financing, there's huge challenges around financing. And again, the same problem of high out-of-pocket expenses continues in both places. There is a shortage of healthcare specialists and workers, and of course, need for infrastructure. If you look at some of the indicators, you'll find that, you look at the global indicators, be it around TB, be it around under 5 mortality, maternal mortality, life expectancy. Both India and Africa have far a lot to catch to be able to come anywhere near the global standards. So keeping that in mind, there was a summit, if you move on, please, a summit organized, will we move on to the next slide? Yeah, a summit organized which really spoke about emphasizing the need for collaborating amongst the stakeholders, the two regions, within the two regions, the players, be it the government, be it the private sector. So we had a plenary section. We also had signing of an MOU between the two federations. And then, of course, we didn't just leave it at that. We actually had a technical session where we tried to identify some of the common challenges that are there, and also find the next steps and solutions towards trying to address these. If you can move on, please. The key objectives of this MOU or the summit was really to try and look at accelerating the sustainable and equitable progress, and that, as I've mentioned, is to be done through collaboration and innovation. We do find that it makes a lot of sense for South-South collaboration because of the similar challenges and constraints that I've already mentioned. So we are trying to foster relationship. Again, we would also be wanting to enable some of the skills and technologies and innovations along with medical education between the two regions. And finally, of course, learning from the best practices of each other. And I'd like to mention here that while India is, of course, by and large ahead of Africa when it comes to a number of indicators and health coverage, but there are a few extremely good examples in Africa as well, which India could learn from, especially within some of the self-help groups, some of the community level work that is being done in Ethiopia and other parts of Africa as well. So there's lots to learn between the two regions as well. The summit had a number of eminent speakers, and if you can move on, please. And it was actually inaugurated by Dr. Harshvardhan. So you had the right positioning. The Honorable Union Minister of Health in India was there. We had the Minister for External Affairs, because as you know that India is also a major funder or supporter in Africa as well. We had the Health Secretary. We had, of course, the senior officials, Preeta Reddy and Harsh Mahajan from NATHEALTH. In addition, we had an extremely good participation from the African end as well. The Commissioner for Social Affairs and some of the ministers as well participated from Africa. Of course, Amit Thakkar, the president of AHF, and was the coordinating counterpart in Africa for this summit. In the technical session, again, it was a very engrossing session because we had the Secretary Department of External Affairs, who's really in charge of the India's funding to Africa. So he was Rahul Chabra was there, along with some of the other donors. You had representatives from BMGF, you had USAID, you had IFC. So it was a very intense discussion about how we could really translate this MOU or this broad high-end discussion into really specific collaboration between the two regions, and if you could try and find ways of working together, because till now India has been working on its own in Africa, and some of these international aid agencies have also been working on their own. So they also found this as a platform where they could perhaps collaborate as well. And Mr. Rahul Chabra was quite open, saying that now India is willing to collaborate with some of these agencies and work in Africa as well. So I think that was something very positive that came out of the workshop, because till now they've all been working independent of each other. So that was a good sort of takeaway from that as well. We had about 150 delegates comprising of government officials, policymakers, and it was extremely well attended from representatives across about 20 African countries. NATHEALTH actually has chapters across Africa, so they were all participating as well, and it was a very engaging discussion. Can we move on, please? Yeah, move on to the next one as well. Yeah. Now, some of the key recommendations from this summit were to look at collaboration, look at how private sector and the government within these countries, as well as cross region, could collaborate on this. How the industry within India as well as industry in Africa could collaborate, and how the association could deliberate more to try and remove some of the barriers. There are a number of barriers of working in these regions. For instance, you've got medical tourism as a challenge, you've got transfer of skills as a challenge, you've got infrastructure creation as a challenge. So looking at ways to really overcome these challenges and work together. It was decided to form a few task forces who would then go away and come back with detailed reports on each of these areas, and then to be able to look at regular interaction between these federations as well as government in both sides and private sector, to try and really convert this entire discussion into action plans and then into results on the ground. Because at the end of the day, it would be a pity if a summit doesn't get converted into action plans. So that was the objective of this. Can we move on to the next slide, please? There was an MOU signed at a high-end level between Ms. Preetha Reddy and Dr. Amit Thakkar on behalf of the two federations, where they decided that they would be looking at barriers of access to quality healthcare and looking at harnessing technology and infrastructure, as well as learning and workforce between the two regions. So this was an extremely good start. I have to say that last year was a very challenging year, as we all know, across the world, and the very fact that NatHealth was able to really come forward with a very important MOU and trying to sort of work across regions. I would really give full credit to NatHealth on this. Could we move on to the next slide, please? As I mentioned, there were 4 task forces which were formed, and they are being now chaired by members of NatHealth as well as counterparts of the Africa Health Federation. The first task force is on sustainable and medical value travel, because we do see a lot of traffic coming from Africa into India, and they have a lot of challenges around transparency, around rates, around getting the right infrastructure, the right treatment, the right kind of post-medical treatment as well. So this task force is going to look at issues around this and then come up with a recommendation, which, if required, will also be presented to the government. The second task force is going to be looking at skill transfer and training. India has a lot of e-learning already in place, and a lot of African regions were interested to really participate in e-learning. And at the same time, as I mentioned, there's lots to learn from Africa as well. The third task force is going to be working around infrastructure development, specifically around hospitals and diagnostics. As I mentioned, the government of India is already supporting some infrastructure development in these regions, but till now has been working standalone along with their counterparts or embassies in those countries. We hopefully, through this particular deliberation and the follow-up work that the task force does, we hopefully will have more collaboration between the governments as well as the private sector in these two regions. And finally, of course, healthcare is one of the sectors that requires maximum research and the use of artificial intelligence. So that's something that the fourth task force is going to be looking at, how we could really take the best practices and we could achieve economies of scale as well as look at investments. Now, having said that, these were the sort of 4 broad task forces, but we've also decided to regularly engage with the international aid agencies and the government to see how actual collaboration can be done on the ground as well. So talking about the progress till now, if you can move on to the last slide. After the formation of task forces, they have already started meeting. Some of the members of the task force have been identified, but there's lots more to be done. I mentioned they will be coming up with a specific action plan and then engaging with individual stakeholders and funding organizations to try and see how these action plans and the overall vision that is there as part of the MOU can actually lead to results on the ground. Because at the end of the day, that is, I would really consider this summit and the MOU a success only if we can see results on the ground. And from the early weeks and months that we can see, I think NatHealth and the Africa Healthcare Federation are both committed to take this further and ensure that results are there on the ground. So thank you so much. That's what this a brief presentation on this entire MOU signing and the work that's going on. And it's important that both regions work together if we are looking at the SDG Goal 3 of well-being for all. Thank you so much. That's all.
Thank you very much indeed, Mr. Singh. That was really a very illuminating presentation about India, Africa. So thank you very much. And with that, ladies and gentlemen, we will now proceed to the closing remarks. We flagged off day 2 and the session 4 as part of the NatHealth 7th Annual Summit with a stellar introduction by Dr. Ashutosh Raghuvanshi, the Secretary of NatHealth and CEO of Fortis. And now I'm going to request him yet again to render his concluding remarks. Once again, an honor, sir, to hand it over to you. Dr. Ashutosh Raghuvanshi, sir. Please take away.
Thank you, Ashwarya. This was a wonderful session. The discussion was very engaging and covered various aspects of the infrastructure gaps, as well as some very encouraging thoughts from our keynote speakers. Mr. Anurag Singh Thakur started the session with appreciation of the efforts which were put in by the medical community, both in the private and public sector. He touched upon how the infrastructure has been built and how some of the programs like Ayushman Bharat, Jan Aushadhi Kendra, etc., are working. He also spoke passionately about his personal involvement in the eradication of tuberculosis program and the mobile health clinic program. I think there is some food for thought over there. Followed by that, Mr. Dr. Rajesh Bhushan's, our Secretary of Health's talk was very enlightening and very encouraging as he spoke about the new framework represented by National Health Mission, which the bill has been passed in the Parliament this week. He also spoke about the nursing education and the other councils. He spoke about the national health policy, skill development, and the ultimate vision of how to achieve universal health care. And he did outline the focus areas of health infrastructure, robust mechanisms, workforce, high-end drugs and devices, and how we should become self-reliant on these fields and health-seeking behavior above all. The second panel discussion of speaking about the urban population, Mr. Rohit Sate pointed out the shortage of beds, etc. He also pointed out the lack of medical equipment, especially in the urban and in the rural areas. And this was followed by the experts. Dr. Roy mentioned about the extraordinary budget. He did mention the gaps in the nursing, doctors, and allied services, and also some of the challenges which Tier 2 and Tier 3 cities face in terms of skilled workforce as well as infrastructure. He did mention about the technology and how important that is for us to create a sustainable infrastructure in the Tier 2 and Tier 3 cities. Dr. Pranav Mohan shared his views, and he did mention about the expansion and increase in investment in public healthcare infrastructure. He did speak about the major bottlenecks, also creating new infrastructure to utilize and absorb additional workforce which is being created by the government initiatives. He did mention very interesting proposition in which is about the model in Turkey, where private companies have invested in creating infrastructure for managed by the public sector. So, which is something very unique and has not really been tried, at least in my knowledge, in India. This was followed by Mr. Sunil Thakur's comments on how the government should do the urban planning in healthcare infrastructure. He did touch upon how the clinical care pathways and awareness is very important. He also mentioned again about technologies and accrediting hospitals to start using technology. The second session of unlocking of Gate to Bharat was highlighted by Mr. Pradeep Kumar Mahapatra, Additional Chief Secretary Health of Orissa. His talk, he did mention about the various initiatives the Orissa government is taking and how that is going to impact the healthcare in that state and how the private sector is playing an important role in achieving those objectives. The session was moderated by Ms. Priyanka Agarwal. She mentioned about the gaps which are there, and Mr. Matthew started by talking about the problems of information symmetry, use of technology, and problems of investments. He suggested pan-India call center, digital use of all healthcare needs, etc. Dr. Arvind Lal followed it by talking about how the underinvestment has happened in the sector. He did highlight the need of financial viability to be looked into when the projects are expected in tier 2 cities, as the current reimbursement structures do not sustain a viable proposition. So he did mention about how the GST, tax holidays, and other incentives and gap funding, etc., may be necessary in order to develop this infrastructure. This was followed by Dr. Vivek Desai's comments on how the best infrastructure in tier 1 and 2 cities is there. But he also mentioned about medical technologies which could be scaled down, and an infrastructure which is suitable for those geographies is created, and there is some kind of prudence in how the capital is spread in tier 2, tier 3 cities. He mentioned some of the experiences he has had with various projects in tier 2 cities, and how those were challenging because of the kind of ground realities which exist. He did mention about how the cost of manpower sometimes is extremely high in tier 2 and tier 3 cities. Ms. Priyanka concluded by mentioning the digital disruption, need for more PPP models, and the huge challenges which are there. And she highlighted the importance of government and private sector working together. Dr. Arvind Lal suggested that underserved facilities, as doctors don't go there, 80% practice in the urban areas, and lack of infrastructure in these areas is one reason why the workforce is not attracted to the tier 2, tier 3 cities, and a lot needs to be done in that direction. Overall, I think the session was very, very informative, very spirited comments by all the panelists and the keynote speakers. I once again thank all of us, all our panelists and the moderators, as well as the audience for participating in this session. Thank you.
Thank you very much, sir, for sharing the pertinent key learnings from this entire session, which was on infrastructure expansion. And thank you for, helping us see a vision of how we can reimagine health infrastructure development over the next 5 years. So thank you very much once again, sir. So ladies and gentlemen, that was Dr. Ashutosh Raghuvanshi, the Secretary of NATHEALTH and the MD&C of Fortis Healthcare Limited, wonderfully summing up this session 4 for us at the day 2 of the 7th annual summit of NATHEALTH.